Good evening. I'm Charlie DeMar in for Jim Williams. Tonight, nursing home patients in Illinois are dying at an alarming rate due to COVID-19. Tonight, there's a growing push to track where those deaths are happening. Governor J.B. Pritzker announced an additional 125 deaths in the state, matching the highest daily total. CBS 2's Mike Puccinelli joins us now live outside the Thompson Center. Hey, Mike.
Charlie, Illinois has more than 1,200 nursing homes and about 100,000 people live in those long-term care facilities. But those residents account for about 1/4 of all the COVID-19 deaths in the state. Now, long-term care facilities have been in the spotlight in the last few days after the deaths of 22 residents of the Symphony of Joliet home were attributed to COVID-19. A staff member there also died from the virus. 16 of the residents of Symphony currently have tested positive and are being treated inside that more than 200-bed facility. Another 37 residents tested negative and were moved to alternate locations. Now, the director of the Illinois Department of Public Health says a strike team was sent to Symphony to analyze what happened and what can be learned from a single nursing home that accounts for more than 20% of the total deaths in all of Will County.
So we have had assistance, direct assistance given to Symphony. I know that, reviewing of all the infection control protocols, making sure that people know how to properly don and doff PPE, making sure that the pre-shift assessment, so there's a full survey that can be reviewed to make sure you identify the areas of weakness and then, try to identify where IDPH can specifically support.
In all, about 300 COVID-19 deaths have been recorded in long-term care facilities. That's about 25% of the total deaths in the state. That grim number now stands at 1,259 COVID-19 related deaths. Reporting live outside the Thompson Center, Mike Puccinelli, CBS 2 News.
Mike, thank you.